We're here with Dr. Irene Wesley with the USDA National Animal Disease Center in Ames, Iowa at the Midwest Poultry Federation Convention. Dr. Wesley has just given a talk about the dynamics of Salmonella and Campylobacter in turkey flocks. Dr. Wesley, you mentioned quite a number of possible interventions to control Salmonella and Campylobacter in turkeys. What are some of the more interesting or promising interventions that you discussed?
The interventions that I outlined were based on a very interesting set of publications coming out of the European community. Interestingly, the interventions had an associated risk-benefit cost analysis with them. So, for example, when we look at on-farm interventions, biosecurity is by far one of the most effective. And there's also a cost associated with those on-farm interventions. Interestingly, one of the key methods of transmission of both campy and salmonella on turkey farms is the dragging in of contamination from the outside into the flock. One of the ways that farms have been able to reduce this is by the use of boot dips. It turns out that boot dips actually, if not used effectively, will cause further transmission of both of these foodborne pathogens. And it was only because a risk analysis was done that it was determined that having a separate pair of boots on a particular farm that would be used only on that premise was a very effective way of reducing the transmission of foodborne pathogens. So do away with the boot dips that are present in so many of the premises. Another on-farm intervention that was effective was the use of feeder pans as opposed to other types of feeders. And the idea is that the feeder pan will cut down on contamination that's spread from bird to bird to bird. A whole lot of other interventions have been mentioned on the farm, and one that I would just like to bring to folks' attention is the growing concern that perhaps we're going to have to address the issue of foodborne pathogens with vaccines. The issue will always be effectiveness of the vaccine, cost of the vaccine, and how do you deliver it. It's one thing to vaccinate a single child for mumps, measles, and rubella. It's quite different to try and immunize a total flock of 10 to 20,000 birds against a particular foodborne pathogen.
Well, one thing you mentioned was ventilation had no effect on the number of Campylobacter in flocks, but it did have an effect on the number of Salmonella.
Right. This is a study that we did in collaboration with the Iowa State University as well as a commercial turkey producer. So we were actually looking at commercial, in a commercial setting. We hypothesized that increasing the ventilation in a house would result in a reduction of both campy and salmonella. Much to our surprise, the level or the prevalence of Campylobacter was the same on the naturally ventilated houses as in the mechanically tunnel ventilated houses. For Salmonella, however, there was a drop in the percentage of positive birds for Salmonella. And we think that the reason for this is that the increased ventilation might have kept the litter drier, and this might have impacted the spread of Salmonella. But again, just to show us that ventilation in a house can be added for a number of reasons, and one of the side benefits could be a potential reduction in at least Salmonella.
Well, I understand from your talk that there's been a decrease in Campylobacter in turkey flocks. Could you tell us a little bit about that?
Right. The birds right now are sampled at slaughter, and so when we look at the external carcass of a bird, we'll see that indeed the levels of the prevalence of campy is lower than what we had seen maybe 5 years ago. And at first we thought this was a problem with our method for screening and detecting campy. So we're actually seeing a decrease on the carcass of a turkey. When we look at the ceca, that is the intestines of the turkey, we find that they are coming into the slaughterhouse at maybe a 90 to 100% prevalence rate, but it's all of the HACCP interventions that are ongoing at the slaughter plant that are bringing down the level of Campylobacter to, say, within the 30% range. But these data were all taken before the birds experienced the last intervention, which was a chlorinated chiller. We tend to take our samples just before the birds go into the big bath, which brings about a further reduction in both Salmonella and campy.
Well, Dr. Wesley, what do you consider to be the most pressing issues or needs for industry response at this time in terms of regulation and research and other interventions that might occur?
I think with respect to research, basic research would fall into two areas. There is a lot of interest, justifiably, in probiotics, direct-fed microbials for the specific results or impact on one bug. I think it's a lot better, holistic, universal approach to look at the entire microbial communities to see if these interventions are having perhaps a unknown detrimental effect that we can see if we just take a snapshot at the whole microbial community. So I think we have to look at microbial community analysis, and that's being done now. And secondly, with respect to applied research, I feel that the turkey industry should somehow be able to do on-farm risk assessments in collaboration with USDA APHIS that has done this for other commodity groups such as pigs and cattle. This will give us a real numerical, quantitative impact on what interventions work on farms that have low levels of Salmonella and what interventions do not work on farms, and we can just completely abandon those interventions in place. This is what occurred in the study that showed boot dips actually were counterproductive versus changing boots. Simple, not so simple studies like this actually give us a number, and we can be more focused in reducing both campy and Salmonella on farm.
Thank you, Dr. Wesley.